Hello everyone, this is Dr. Alexandra Hall from UW Stout, and I'm going to be talking to you today about how to make a clay version of the viscera of the posterior abdominal wall. So if we're doing a dissection and we open up the abdominal cavity, remove the intestines, this is what we're going to see. So I've taken the liberty of already creating some of the structures to get us started. So one of the most visible things when we look at the posterior abdominal cavity is we're going to see the abdominal aorta and the inferior vena cava. So we're going to start there. As the abdominal aorta travels inferiorly, it's going to bifurcate or split into two arteries, the common iliac arteries. The inferior vena cava is also collecting blood from the inferior part of the body, so we also have common iliac veins. And the important thing to know about those is that they are posterior to the common iliac arteries. We've also learned already about the major branches of arteries coming off of the abdominal aorta. So our first branch of arteries, once we get to the inferior side of the diaphragm into the abdominal aorta, is going to be the celiac trunk with its three branches: the common hepatic artery, the splenic artery, and the left gastric. Next off the abdominal aorta, we're going to find the superior mesenteric artery, which you will recall is bringing blood to the small intestines via the intestinal arteries, and then also sending off the ileocolic artery, the right colic artery, and the middle colic artery to supply the right or ascending and transverse colon. We have also already learned about the inferior mesenteric artery, which is located much farther down on the abdominal aorta. It's going to head out toward the left, and it's going to give off, it's going to give off the left colic artery, the sigmoid arteries, and the superior rectal artery, supplying those structures for which they're named. Now, I always talk about building from posterior to anterior, and I've broken my rule here because our most posterior structures are actually four paired arteries coming off of the aorta and traveling out to the lumbar vertebrae. So these are called the lumbar arteries, no big surprise there. And we're going to have four on the other side as well, and those actually travel posterior to the inferior vena cava. So I'm just going to slide those in there. Okay. There's also two other sets of arteries that we haven't yet talked about when we were talking about the digestive system. One is the renal arteries. They're going to come off just inferior to the superior mesenteric artery, one to each side, to supply the kidneys. The other pair of arteries that we're going to learn for the first time in forever are the gonadal arteries. So gonad is the non-specific term for either the ovaries or the testes. So these are going to travel out either down into the pelvis through something called the suspensory ligament of the ovary to supply the ovaries, or down through the spermatic cord into the scrotum to supply the testes, right? So the non-specific term is gonadal arteries. So of course we are going to need to have some renal veins as well, bringing blood from the kidneys back into the inferior vena cava. And so what's important is that the left renal vein is going to travel anterior to the abdominal aorta. I need to make it a little bit longer too. All right. And the right renal vein is going to be right over here. Now, the gonadal veins are a little bit different. The right gonadal vein is going to travel with the right gonadal artery and then drain into the inferior vena cava. The left gonadal vein, however, is going to have too much of a hard time getting all the way over there. So instead, he says, hey, I'll hitch a ride with the blood coming in the left renal vein. So this is one of those interesting things in anatomy that are interesting to your professors and possibly not to you, that we have some asymmetry here. The right gonadal vein drains into the inferior vena cava, but the left gonadal vein drains into the left renal vein. All right, what organs are we going to find in this area? No surprise, we're going to find the kidneys, right? Renal means of the kidney. So there's the right kidney, and over here is the left kidney, and we're going to look at those details in just a minute. But the other organ that we're going to find back here are the adrenal glands. So remember, AD as a prefix means toward, like adduction, so adrenal, toward the kidneys. They're sometimes also called the suprarenal glands, supra meaning kind of above and beyond, right? And they sit right on top of the two kidneys, kind of like hats. All right, so let's take a closer look in at the kidney here. So the kidney is basically divided into several different regions. First of all, we have a membrane that surrounds the outer surface of the kidney. That's called the renal capsule. Next, we have an outer rind of tissue here, and that's called the renal cortex. I always find that kind of confusing because core to me thinks of middle, but in anatomy, anytime we call something the cortex, it's the outer rind, the outer area of something. So this whole area here is the renal cortex. That's where we'll find the glomeruli and the peritubular capillaries and the proximal and distal convoluted tubules. In the midsection, this middle region of the kidney, which is called the renal medulla, we're going to find the renal pyramids, which are these triangular-like structures. And if you look closely at them, you'll see they have these little striations that you can just make out. Those are actually the collecting ducts that are collecting and bringing urine that's been made by the tubules in the kidneys down into this point that each one of them have. That point is called the renal papilla. Urine is going to drain down to the renal papilla and be caught by one of these cup-like structures called a renal calyx. And then the calyces come together to form a central collecting area called the renal pelvis. In between each of the pyramids is a structure, just this kind of tissue in between here is called a renal column. Blood vessels that supply the kidney itself are located in that area. The kidney then, of course, needs to be able to move that urine out of the renal pelvis, and it does so through the ureter, right? So then our ureter is going to come down, and it's going to travel down to the urinary bladder. So there we have it. Abdominal aorta, celiac trunk, superior mesenteric artery, gonadal arteries, inferior mesenteric artery, common iliac arteries. Inferior vena cava, common iliac veins. Right gonadal vein drains right into the inferior vena cava. Left gonadal vein drains into the left renal vein. There's our